Good afternoon.
Good afternoon.
Good afternoon, Chair. We will now hear evidence from Timothy Whitfield in relation to his wife, Margaret Maggs Anakin. Before we start, we will show a photograph of Maggs. Amanda, please can we have the photograph on screen? Thank you. Please can the witness be sworn?
I, Tim Whitfield, swear by Almighty God that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Thank you. Please can you state your full name for the record?
Timothy John Whitfield.
You are the husband of Margaret Maggs Anakin, who was born on the 15th of June 1947 and died on the 3rd of July 2015 at the age of 68. Is that right?
At the age of?
68.
Right.
You would like me to refer to your wife as Maggs throughout my questions, is that right? And you would like me to call you Tim, is that right? Tim, I'm going to ask, for the purpose of the questions, if you can confirm your answers by saying it for the benefit of the transcript. So, Tim, if you can say yes at the end of the questions.
Or no.
Or no, indeed. Yes. By way of background, the inquiry sent a Rule 9 request for evidence to your legal representatives on the 7th of February this year, and in response to that request, you've provided a witness statement to this inquiry. Is that correct?
Yes.
You have a copy of that witness statement in front of you, I hope, and it is 123 pages long and dated the 27th of August of this year. If you look at the first page, just at the header on the right-hand side, you should see that date. Is that right?
Yes.
And if we turn to the last page of that witness statement, at page 123, you made a statement of truth and then you signed your witness statement.
Yes.
Have you had an opportunity to read through the statement recently?
Yes.
And is your statement true and accurate to the best of your knowledge and belief?
Yes.
As you know, that witness statement will therefore stand as your evidence to this inquiry. Although I'm going to ask you some questions about that witness statement, I'm not going to take you through it line by line or ask you to read it out. But please be assured that the Chair and the inquiry team have read and considered everything you say in that statement very carefully, and it will form part of the body of evidence on which this inquiry will rely. I would also like to acknowledge that you've provided a commemorative and impact account in relation to your wife Maggs, and the inquiry is extremely grateful to you for that evidence as well as for your evidence today. I'd like to remind you that I will not be asking you to name any individual staff members today, so please try not to do so. And if at any point you would like a break, please do bring that to my attention. Please do try and keep your voice as loud as you comfortably can so that your answers are captured on the transcript. Your evidence will focus on your concerns in relation to Maggs' care and treatment under the North Essex Partnership NHS Foundation Trust, which we will be referring to as NEPT, and which merged in April 2017 with the South Essex Partnership Trust to form the Essex Partnership University NHS Foundation Trust, which we will be referring to as EPUT. And EPUT is the reference that you use throughout your statement. Is that right?
Yes.
The events within your statement come from your recollection of what you saw and were told at the time, but also to a large extent medical information and records that you have obtained since Maggs' death. Is that correct?
Yes.
I'd like to start by setting out a timeline of Mag's involvement with Essex Mental Health Services. I will summarise the timeline and key dates taken from your witness statement, but please do stop me if I summarise anything incorrectly. Please also feel free to refer to your statement as you wish throughout my questions. As I understand it, according to your witness statement, Mags had a long history of anxiety and depression, including periods of acute panic attacks, which started in 1987. Is that right?
Yes.
Mag's past history of physical health conditions included an acute myocardial infarction in her 40s, a left ventricular thrombus, which had been treated with warfarin in 2008, and an apical aneurysm in 2009, and claudication around the same time. Is that right?
Yes.
In early 2014, Mag's anxiety was worsening considerably, and after suffering from nausea for several years, her nausea became so severe that she was unable to eat. Is that right?
Yes.
Mag's paroxetine prescription was increased at that stage to 40 milligrams, and she was referred by her GP to see a doctor at the Crystal Centre. Is that right?
Yes.
On the 19th of March of 2014, Mags was reviewed at the outpatient clinic at St Peter's Hospital. In early October 2014, Mags was seen at A&E on the Isle of Wight following pain to her left leg and was told she had a blood clot in her leg. Is that right?
Yes.
She was prescribed aspirin for thrombophlebitis. Is that right?
Yes.
And on the 8th of October, Mags began 3 months of treatment for deep vein thrombosis to her left leg, and she began taking warfarin. Is that correct?
Yes.
On the 21st of October 2014, after taking a substantial overdose of tablets, the decision was taken to admit Mags. And on the 22nd of October, Mags was transferred from Colchester Hospital for informal admission to Ruby Ward at the Crystal Centre. Is that right?
Yes.
This was Mag's first psychiatric admission. Is it?
Yes.
During her admission, her antidepressant medication was changed from paroxetine to venlafaxine, and she also began taking olanzapine. Is that correct?
Yes.
Mags is said to have settled well into the ward, functioning and engaging with staff and other patients, and participating in activities. Is that right?
Yes.
On the 3rd of December 2014, Mags was discharged from the Ruby Ward and referred to Amethyst Day Hospital for follow-up by a community mental health nurse. Is that right?
Yes.
Mag's discharge medication included warfarin and aspirin. Is
Yes.
that right? In early 2015, Mag's mental state gradually deteriorated, and on the 27th of March 2015, she was seen urgently at Amethyst Day Hospital, having expressed strong suicidal ideation and describing loss of appetite and feeling unsafe and afraid. Is that correct?
Yes.
Mags agreed to be readmitted informally and was admitted to Ruby Ward at the Crystal Centre that afternoon. Is that right?
Yes.
During Mag's second admission to Ruby Ward, she went on a week of home leave and following a review went on a further week of home leave before being discharged on the 22nd of April 2015. Is that right?
Yes.
Towards the end of May 2015, Mags began presenting with signs of left ventricular thrombosis. The major symptom was a painful leg, and other symptoms, as you describe, were difficulty in passing solids, at least one mini stroke, and general weakness. Is that correct?
Yes.
On the 3rd of June 2015, you phoned the crisis team as you were concerned that Mag seemed confused and had been dropping things. Later that day, you were advised that Mag should see the GP to rule out possible dehydration or other physical causes for the recent deterioration, and that an appointment would also be arranged with a psychiatrist in the next week. Is that right?
Yes.
On the 8th of June 2015, Mags was visited at home. She was unable to stand or walk without assistance, saying that her calves were painful. She was asked if she had had DVT in the past, and she said she had. Is that right?
Yes.
That morning, Mags saw her GP, who found nothing physically wrong with her leg. At the same appointment, you mentioned your concern about Mags experiencing 2 instances of significant confusion. Is that correct?
Yes.
The GP referred Mags to hospital for an endoscopy, prescribed codeine for the pain in her legs, and on the 9th of June, took bloods. Is that correct?
Yes.
Mags also saw an osteopath.
Yes.
On the 11th of June, Mags was reviewed by a consultant in old age psychiatry at Cherry Trees, St. Peter's Hospital, reporting low mood, reduced appetite and weight loss. And that doctor, Dr. C, we will be calling that person for the purposes of this hearing, offered to admit Mags to hospital. Is that right?
Yes.
On the 12th of June 2015, you went to Cherry Trees, St. Peter's Hospital, and informed them that Mags wanted to be admitted. Efforts were then made to find an inpatient bed for Mags, and because there wasn't any room at the Crystal Centre, she was admitted to Finchingfield Ward at the Linden Centre at 9 p.m. on the 12th of June. Is that right?
Yes.
For the purposes of today's evidence, I understand that you are more familiar with reference to the Linden Centre, so I'm going to try and use the term Linden Centre. If I say Finchingfield Ward, that's what I'm referring to.
Yeah.
At the time of Mag's admission, she'd been due to attend a follow-up appointment with the GP, have a further appointment with the osteopath, and get the results of the blood tests. Is that right?
Yes.
On the 15th of June, Mags's birthday, you attended a meeting with Mags at the Linden Centre, which was chaired by her new consultant, who we will be referring to as Dr. D. He explained that he had decided to put Mags back on to paroxetine, and you asked about the pain in Mag's legs, and he said something to the effect that the pain was imaginary or psychological or psychosomatic. Is that right?
I don't know if it was those 3 words exactly, but that was it. And I looked at him and his colleagues, and they were all nodding. So, it was imaginary.
Yes,
Yeah.
and we will come back to that specific point in that conversation.
And I turned around to look at Mags to see what she thought of it, and she was past caring, really.
Yes. And Mags said that it felt like something vascular during that meeting, is that right? And that it was very, very painful, and walking any distance distressed her.
Yeah.
Is that right? And then over the 13 days Mags spent at the Linden Centre, she spent most of her time in her bed space. Her ability to mobilise and carry out daily activities declined. She regularly complained about pain in her right leg, receiving paracetamol and codeine as pain relief, and her ability to mobilise declined to the point that by the Tuesday, the 23rd of June, she was observed shuffling on the floor and on her bottom to move between chairs. Is that right?
Yeah.
And by late morning on the 23rd of June, Mags was seen by a therapist who knew her from her previous admission to Ruby Ward, observed her sitting on the floor in the ward corridor and pushing herself along. This therapist spoke to Mags, noting her feet were very pale in colour and her right foot appeared slightly blue. He informed the nursing staff and Dr. D of his concerns regarding her leg, and Dr. D said one of the doctors would be able to see Mags that day. Is that right?
Yeah.
It appears from the records that Mags was seen by an on-call doctor on the 23rd of June and a referral made to the surgical team at Broomfield Hospital. Is that right?
Yes.
The following day, on Wednesday the 24th of June, when you visited Mags that day, she was in such pain and distress that she could not sit still stand up or really communicate. Is that right?
Yeah.
You went to speak to the ward sister, but as she was locked in the office with other staff and patients were queuing outside, you did not stay.
No, it was chaotic. I remember it was a nice sunny day, and the office where the ward sister, or whatever her title was entirely transparent. So you could see her sitting at her desk in the office, and she had a couple of colleagues with her, and 2 or 3 patients were in there as well, and there was a crowd of other patients waiting to go in there. And I wanted to speak to her, and it was impossible. I couldn't speak to her. I wanted to say, when are you going to do something about the pain in Max's legs? But I didn't get a chance.
Yes. And we will come back to the discussion that you had on that day with Mags and with others, and the opportunities that there were to speak or not.
Yeah.
The following day, on the Thursday, the 25th of June, according to what you've been able to read of the records, it appears that at 1 a.m. an on-call senior house officer examined Mags in relation to purple legs noted by staff that evening and recorded there being no pain associated, no abnormal colouring, and for Mags to be reviewed if further concerns. Is that your understanding from the records?
Yes.
Later that morning, Mags was reviewed by Dr. D and a further doctor, who we'll be referring to as Dr. E, explaining that she felt very, very unwell. Her legs were examined by Dr. E, who noticed tenderness in her right calf and a change of colour, weakness of her right foot, and it was recommended that due to her declining mobility and the discoloration in her lower legs when standing, she be referred to A&E for further investigations with the vascular team. Is that right?
Yes.
Mags was taken by 2 members of staff in a wheelchair to A&E at Broomfield Hospital. Is that correct?
Yes.
She was seen at 1:07 p.m. by a senior sister who could not find blood pressure readings. She appeared clammy, and the A&E sister immediately phoned to have Mags taken to the resus ward, with the resus team putting a heated blanket on Mags and an oxygen mask, and the doctors carrying out ultrasound scans on her legs. Is that right?
Yes.
Mags was then transferred by ambulance under flashing blue lights to the Princess Alexandra Hospital in Harlow at 6:30 p.m, and that night she had an operation to remove the blood clot. Is that right?
Yes.
On the 1st of July, Mags underwent another emergency surgery to remove another large blood clot. Is that right?
Yes.
After the operation, Mags was admitted to intensive care. She continued to deteriorate and required respiratory and circulatory support. The options were to perform a bilateral above-the-knee amputation or to take a palliative approach. This was discussed with you and your sister, and in view of Mag's poor clinical condition and quality of life, it was agreed that treatment would be withdrawn. Is that right?
Yes.
Take as long as you need.
Yes. My sister came up all the way from Bath.
Yes.
And she ran a what do you call them? A hospital where you
Hospice.
go. Hospice. That's right. She ran a hospice outside Bath. So she knew about the dying, and she agreed with me that that's what we should do. Yeah.
Yes. And is it right that the following morning, on Friday the 3rd of July, Mags died?
Yeah. I was with her all night. Yeah, and she wasn't expected to live as long as that, but she did. She died at 6:30 the following morning, 3rd of July.
Thank you, Tim. Now we've set out a timeline of Mag's involvement with Essex Mental Health Services. I'd like to ask you some questions concerning the key concerns that you have. And you explain in your statement that your gravest concern is that Mag's physical medical problems were mismanaged while she was an inpatient at the Linden Centre. Is that correct?
Yeah.
And as a consequence, and given the extent of the medical records within the statement, I'm going to now take you through in greater detail and ask you questions specifically about the 13 days she spent at the Linden Centre between the 12th and the 25th of June.
Yeah.
I'll be referring to page numbers and within those, where I can, to appropriate paragraph numbers. And in each case, if it's a reference that I think you would be greatly assisted by turning to, I will specifically say that. But otherwise, I will tell you the reference so you can turn to it if you want to.
Yeah.
Mags was admitted to the Linden ward, the Finchingfield ward at the Linden Centre, which we will call the Linden Centre, at 9 p.m. on the 12th of June. Were you with Mags that evening?
Yes.
And how did Mags seem to you whilst you were waiting for access to the ward?
Well, it was late in the evening, 9 p.m, and she went to that ward because that was the only space. She would normally have gone to the Crystal Centre, because the Linden was meant to be for younger people, but they were the only place that had a space, so that's why we went there. And so we were told to go to the Linden Centre. We arrived at the Linden Centre. The doors were shut and locked. I think there was a bell which I rang, but for a long time nobody came out. And Mags was in so much pain with her leg, she had to sit on the ground there, outside the Linden Centre, waiting for someone to open up. Yeah, which they did eventually. Yeah.
I recognise it's at some distance. We're now 10 years on.
Yeah.
But can you give a sense of how long you were waiting for outside?
It was probably about 20 minutes. Yeah.
And there was no one to greet you or to bring you into the centre?
No.
To the ward? Can you recall anything further about what happened whilst Mags was waiting to be admitted before you said goodbye to her that evening?
I don't think so.
And you were asked during an evidence session that you did with the Essex Mental Health Independent Inquiry, which we will be referring to as EMI, whether you or Mags, as part of the admission, told the doctor when she was admitted that she had previously had a blood clot in her leg and that she had pain in her leg. Can you recall whether you raised those matters when she was first admitted?
I don't know if I did, because I knew that there was going to be a big meeting the following Monday. Remember, this was Friday night.
Yes.
And it coincided, well, it didn't coincide, but the consultant there said that there would be a meeting on Monday morning, which I was invited to, and all the rest of the staff, senior staff, were going to be there, and we were going to discuss Mags. And it was then that I mentioned the problems with the pain she was having in the leg.
Yes.
And the doctor said it was, implied that it was psychosomatic. I think I mentioned before, it didn't use those exact words.
Yes.
And I looked around the room and the others were just saying, yep, that's what it is. It's in her head.
Yes. At this point, I want to just turn you to some of the medical extracts that you have in your statement, if I can.
Yeah.
And first to page 39 of your statement. And in the middle of that page, on page 39, you should see what's titled a joint psychiatric and physical assessment form. Can you see that?
Yeah.
And this form is dated the 12th of June, so the date of Mags's admission.
Yeah.
And it records new pain in right leg, which, is this right, would tend to indicate that they were aware at this point on the 12th of June of the pain, and says, which she attend GP to investigate. Reports mood has deteriorated since onset of pain. Right foot pain, sees GP and osteopath. And then systemic review, MSK, which may be musculoskeletal, pain in right foot, has seen GP and osteopath, no swelling, skin changes, calves SNT, good peripheral pulses. Do you see that?
Yep.
And so it appears that there was a physical assessment to some degree conducted on her admission. Is that your understanding?
Well, it refers to her GP, who gave her the all clear. But I'd mentioned to him that before we went to see him, Mags had dropped a very valuable piece of glass which shattered on the kitchen floor, and she was completely oblivious to it.
Yes.
I mean, subsequently, that was signs of a stroke that she'd had, a mini stroke, because she was in. But the GP laughed it off.
This is something that happened when you saw the GP with Mags slightly earlier, a few days earlier in June. Is that right?
Yes, that's right. That was. But that was just about the couple of days, or even the day before she went to the Linden Centre. Yeah.
Yes.
Yeah.
And is it right that from discussion and correspondence with a good friend of Mags, who was a doctor, it became clear to you that may have been an instance of a mini stroke? Is that right?
Yeah. Yeah.
And that individual we will be referring to as Dr. F, but he's, as I understand it, a good friend of Mags, who you spoke to after she died. Is that right?
Yeah, yeah.
If we can, I want to just talk a little bit about that first weekend, so before the meeting on the 15th of June. And if you want to, I'm going to be referring to the medical records from pages 41 to 45 and some of the entries there.
Yeah.
And firstly to page 42, where there is an entry from the 13th of June 2015, which is timed at 1:54 a.m. It's in the middle of the page. Can you see that? On page 42.
Yep.
And within that, if you look down to the bottom of that entry where it says plan, and says level 2 observations commenced, seen by duty doctor, who will complete physical assessment in the morning, baseline physical checks done. And then the next entry down,
Yep.
if you turn, in fact, just there, clinical examination with Ree to the right, great toe pain. Margaret reports that she twisted her, and then over the page, knee and injured her RT right. G toe a week ago caused bruise in RT great toe, no signs of acute inflammation. And that is an entry from 10 a.m. on the 13th of June. So it appears to be from that morning, the first full morning that she spent
Yeah.
at the Linden Centre. Is that right? Is that your understanding?
I mean, it could be the GP, but you're saying this was from the Linden Centre, their view, rather than the GP's.
Is it your understanding that in fact it's not clear? Is it your position that it's not clear to you quite what happened over that weekend? Is that right?
Yes. Well, that was Saturday, wasn't it?
Yes. So it's the first day that Mags is spending at the Linden Centre.
Right. Because there's another place when she talks about injuring herself in sand, but
Yes.
that's not here.
Yes, here it appears to say Margaret reports that she twisted her knee,
Yeah.
but in later notes it appears there's reference to her injuring herself in sand.
Yeah.
If we look at the next entry just there, on the 13th of June at 8:14 p.m, can you see that just below the one we were looking at on page 43? We can see reference to Mag's behaviour and her state while she was spending her first day at the Linden Centre, and it says spent the whole day in bed, little food intake, started on food and fluid charts, bloods, ECG and physical health assessment done by duty doctor. And so at this point it appears that she spent the whole day in bed. Is that right?
Right. Yeah. Well. Yeah. I wasn't there, but yeah.
Yes. And in terms of what was taking place over that weekend, did you have the opportunity to see her that weekend, or was the next time you went in the 15th of June?
15th. Yeah.
15th of June.
Yeah.
We can
because
see...
on the Friday evening I dropped her off, and
Yes.
It was quite late, so Saturday, Sunday, and I knew I was going back for this meeting on Monday.
On the Monday.
Yeah.
And so you needn't turn to it unless you want to, but effectively the records here refer to Mags complained of pains in her right leg, complained of pain in joints and was given 1 gram of paracetamol. And there's further reference to the medical registrar and an ECG that's conducted.
Yeah.
And you may want to briefly look at that record, which is at page 42, if we turn back 2 pages. And you should see their reference to, at the top of the page, ECG, T inversion, DW medical registrar may be a normal finding or a reflection of previous IHD, which that may refer to ischemic heart disease.
Yeah.
Since patient is asymptomatic, non-diabetic, no input required to continue current meds. To gather information, and then it's illegible, previous post-op MI, that may be a reference to myocardial infarction from GP over weekdays. So it appears there that the intention in this record is to gather information from the GP after the weekend is finished. Does that accord with your understanding?
Yeah. I've spent more time looking at what happened towards the end of her stay in the Linden Centre, forgetting what had gone before.
And at this point, Mags had been due to attend a further appointment with her GP before she's admitted into hospital, a further osteopath appointment, and to receive the results of blood tests. Is that right?
Yeah, that was on the Friday, yeah.
And you say, I think this is right, in your letter to Dr. F, the doctor who was a friend of Mags's, and your letter to EPUT which was then NEPT, that you didn't hear from the surgery about the results of those blood tests, but you did go in and get the receptionist to print them off for you, but they didn't make much sense to you. One seemed to say, seek advice, and another identical one said no further action was needed. Is that right?
Yes.
And were you told, or as far as you were aware, were these results provided to the Linden Centre, those blood test results?
I don't know.
You don't know? No. We see then on the 14th, so the Sunday, reference to Mags complaining of severe pain in her legs and being asked to be let back onto the ward, and to Mags being assisted with getting to the communal areas as she reported feeling dizzy, having a painful knee and feeling unsteady on her feet.
Right.
Do those descriptions marry up with your experience at that time of how Mags was managing physically?
Yes, yeah, and yeah. It wasn't easy for her to move around.
And if we look then at a final reference in relation to the 14th of June, so the Sunday, she's described in the morning as having a low profile, time in bed space, meals taken in her room, and utilising paracetamol for pain and being unsteady on her feet, and then again reporting pain in her legs.
Yeah.
I want to turn now to the 15th of June meeting, which you've referred to already, and which took place on Mags's birthday with her consultant, Dr. D. And you will see entries in relation to this at pages 45 to 48 of your witness statement. The meeting with the team, which was chaired, I understand it, by this new consultant, or new to you, Dr. D, you described that meeting in your letter to Dr. F, the good friend of Mags, and you say that the good news at that meeting was that Dr. D was saying that he was putting Mags back onto paroxetine, which she'd been on for the last 20 years, which isn't prescribed nowadays. Is that right?
Yeah.
And so you took from that meeting a positive, which was that she was returning to that medication. Is that right?
Yes.
You asked a number of questions during that meeting, including about the pain in Mags's leg. You've touched upon the response that you got. Can you recall how long this conversation about the physical pain was? How much of the meeting did it take up?
It was very short. It probably occupied about 2.5% of the meeting.
Yes. Yeah. And so, is it right that effectively the meeting took place focusing on medication and Mags' psychiatric mental ill health?
Yeah.
And then there was a question asked by Dr. D, did you have any questions? And it was at that last part of the meeting that the discussion about her physical health arose. Is that right?
Yeah. Yeah.
And can you recall what you said specifically or in general terms about Mags's physical pain at that point in the meeting?
Well, I said that it was very painful and had been painful, especially the left leg, for a long time. Yeah.
Do you recall whether, when you mentioned the pain in the leg, Dr. D appeared to already know about that, given the records that we've seen from the previous 2 days and what Mags had been saying about her pain?
He didn't refer to those records if
No.
he had seen them, no.
And you touched briefly on when he's implied that there was something causing the pain that was imaginary or psychosomatic, that you looked to Mags to see her response.
Yeah, yeah. There was no response from Mags. I mean, that was one of the side effects of the pain, that she just didn't want to take part in things.
And so effectively the pain was limiting her ability to communicate the extent of it.
Yeah.
Is that right?
Yeah.
In your letter to the trust that you send much later, you said that you forgot to mention the concerns you had about Mag's confusion and didn't mention her digestive problems because you thought them irrelevant. Is that right?
Yeah.
And this was the one and only team meeting, the one and only opportunity you had to speak to Dr. D during her time on the ward. Is that right?
Yeah, that was the only time I ever saw him.
When you'd mentioned this physical pain, which you got the sense he was telling you was imaginary or psychosomatic, did he indicate that he would be arranging for any further physical examination to rule out?
No, nothing at all.
Did he indicate that he wasn't doing this because there had already been a physical examination or say anything like that?
No.
In the evidence session that you had with Emmy, I understand that you said you didn't mention the blood clot or the DVT from the Isle of Wight in that meeting. Is that right?
Yeah, I'd completely forgotten about the Isle of Wight.
If we can turn to page 46 of the records, there is then, you have set out an extract which appears to be a record of that meeting that took place. And we can see, if you look, this is the entry that says 1:53 p.m. And if you look down to the first bit of full text, this appears to be a quote from Mags. "I twisted my knee joint and this is moving down my leg. And when I ask for pain relief, it is not coming. I think it feels like something vascular. It is very, very painful. Walking any distance distresses me."
Yeah.
Can you recall, does that accord with your memory of what Mags said about her pain in that meeting?
Yeah.
And there is a note of, there is no note there of what you said and the concerns you raised in terms of physical pain.
Yeah.
And I think you say in your statement how disappointed you are to note that this entry doesn't reflect the concerns that you specifically raised with Dr. D. Is that right?
Yes. Yeah, well, yeah. Well,
apologies.
No, I was just, wasn't part of it at all. He didn't register anything. I mean, I quite liked him, his attitude and everything, but when it came to Mags, he just wasn't there.
And so your sense from that meeting was that he wasn't taking that physical pain seriously?
Yeah.
But your evidence is that you did mention it yourself as something that you were concerned about.
Yes, yeah.
Thank you.
Is there anything further you can recall about that meeting?
Well, no, I mean, it was so short, apart from anything else. It was like 1 minute we were talking about it, and the next minute we were talking about something else, and we didn't go back to that at all. And you know, no one seemed to mind at all. This was how things operated.
And when you left that meeting, what was your understanding of the plan in terms of Mags's care and treatment?
I don't remember anything about it. I can't remember anything that she was specifically told that she was going to do at all, because I would have immediately imagined Mags doing it and turned round to her expecting her approval, but there was nothing that he didn't suggest anything anything physical at all.
And so was it your sense from the meeting that the focus or your understanding of the plan was primarily based on medication and that change of the medication that she was to receive?
Yeah, I mean that didn't take long to change it back to paroxetine, and I mean I was happy with that.
If we look at the previous page, page 45, there is a note which appears to be of the same meeting. It's ward review notes. And in your statement, you have made bold a particular line within that passage. Margaret says she was brought into hospital for depression, CO injury in right knee after walking in sand. I think this is the reference you made earlier to there being reference to her walking in sand. Is that right?
Yeah, I mean, thinking about that, and the only thing I can think of is we did go and visit some friends in Perpignan in France at about that time, just before, and Mags loved the water and she loved swimming, and she wouldn't go in the water there in Perpignan. I couldn't understand it. I think that I don't know about walking in sand or anything, but maybe that, I mean, it kind of was a confusion thing with
yes.
Mags. By that stage, she wouldn't go in the water.
And so maybe, is this right? It may be that she mentioned that, but if we look at the line next, mentioned she feels problem is vascular, but cannot justify why.
Yeah.
Do you recall whether Dr. D asked any questions of you or Mags as to why she might say the problem was vascular?
No.
Was
Mags said it because that's what she'd had in the Isle of Wight, so she was familiar with what it felt like.
Yes.
Yeah.
And we know, of course, that Mags had the deep vein thrombosis following the Isle of Wight.
Yeah.
Did Dr. D ask about DVT, deep vein thrombosis, anything like that at that point?
No.
There was nothing from your perspective to indicate he knew of that background. Is that right?
Yeah. I mean, she mentions it elsewhere here that she feels it's vascular.
Yes.
And nobody picks up on it at all.
And we can see from the same date more entries that record Mags anxious, pain in leg, had codeine and paracetamol, and records seem to indicate that she was receiving pain relief medication, although Dr. D had said to you that it had implied to you that it wasn't a physical injury. Is it right that from what you've seen of these records, she is repeatedly given pain medication for the complaints that she's making about the pain to her leg?
Yeah.
You may now want to turn to page 47, which has the discharge summary on admission. So this is a document that appears to have been completed at the start or shortly, 4 days after Mags had been admitted, and is completed by Dr. D. And if we look at the title, History of Present Illness, it refers to Ms. Anakin also reported a pain in her right leg for which she had attended her GP to investigate, and says her mood has deteriorated with the pain. And then it refers to DVT, right foot pain, for which he sees her GP and an osteopath. So is it your understanding from the records you've seen that although you may not have mentioned DVT or blood clots to Dr. D, he appears to have been aware of that in these records?
Yeah.
There is then, at page 48 in that same entry, reference to a physical examination on admission, which states systemic review revealed only pain in the right foot. for which Margaret has seen her GP and an osteopath. There is no swelling or changes to the overlying skin. The calves are soft and non-tender, and there are good peripheral pulses. What is your understanding of whether Mags had been assessed physically on admission?
I don't imagine her being assessed physically. I mean, I didn't see her again till Monday, so I don't know. I think maybe that's how they did things. As soon as they come in.
And is it right that following the 15th of June, that you were visiting Mags pretty much every day? Is that right?
Yeah.
And so I want to turn now to that period from the 15th to the 22nd of June.
Yeah.
So that 7-day, that week,
Yeah.
following the meeting that you have had with Dr. D and Mags. How would you describe Mags's behaviour and appearance when you visited her?
She was always very, very quiet, and all she wanted to do, she said, "I've just got to find somewhere to lie down, somewhere quiet to lie down." And strange looking back, I can't envisage it now, but each time we were able to find a space, a quiet space with no one else there, where there was a bed. And she lay on the bed with her head in my lap, and I just stroked her hair. And I told her whatever was happening at home with the dogs and stuff, and tried to interest her in other things. But then after about 20-25 minutes, she said, "Well, I've got to go back to bed now. I'm exhausted or painful," or I mean, she was obviously in pain the whole time, but less pain there in that little bubble of just the two of us. Yeah.
And so even in that bubble, she was only able to be part of that for 20 minutes.
The longest we were there was probably 20 minutes before she said, "I've got to go. I've got to lie down. I've got to sleep."
And so we see throughout the medical records regular reference to her being in bed, staying in bed.
Yeah.
And is it your impression that is effectively because the pain was so overwhelming that she simply couldn't interact beyond that?
Yeah, and also she had toilet problems, which she wanted to be, left alone with. I'm sure that was part of it. One of her thoughts was, if I'm lying in bed, I don't have to move. I don't have to move my leg, so I won't have this pain, perhaps,
And we see in the medical extracts you have here regular reference to staff pushing her to be up and to not be lying in bed.
I know this seems true. I can't understand how. I mean, it's just not in Mags's personality to bum shuffle, to just navigate on her bottom everywhere. And the suspicion was that this was Mags playing about or something. But she was in so much pain. I mean, it shows how much pain she was in that she allowed herself to be put in this fairly demeaning position.
Yes.
It's tragic.
And over this period of a week, So we see reference to the bum, her Mags moving on her bottom between chairs and along the corridor on the 23rd of June. And over this period of a week where you're seeing her almost every day, did you see a decline and an increased inability to move in Mags over that period?
I suppose a slight one, but seeing her every day, it was, it wasn't much different each day. The last day was the worst, because she'd managed to get onto a sofa in the television room, and she was lying on the sofa with other patients, and it's a shame that Mags didn't. I suppose that was the only time I saw her with fellow patients, and they were younger than her.
Yes.
And they would have done her a lot of good. But that last day, she was lying on the couch, and lying on the couch, she was in so much pain, and that's when I thought, I've got to see the ward sister. I've got to talk to her.
Yes.
But it was impossible.
And we will come back to that in a moment, because there's in the period between Monday the 15th and Monday the 22nd of June, is it right that you have seen from the medical records repeated reference to the extent of her pain and the extent of her weakness and unsteadiness on her feet? Is that right?
Yeah.
And if we look at those, on the 16th, the Tuesday, Mags is described as unsteady on her feet and needing assistance when walking. She's then found sitting on the floor outside the bathroom, stated that she was waiting for it to be opened, denied having fallen, stating that she had sat down and no apparent injuries were evident. She's then, on the 17th, described as lacking in motivation and very lethargic and low in mood, and had been in her bed space for most of the shift with little interaction with staff.
Yeah.
It appears that inability to mobilise and to interact is being attributed to low mood and lack of motivation.
Yeah.
What would you say about that?
Well, I think it was primarily the pain that was so depressing.
Yes.
And the fact that she could hardly do anything without causing more pain.
We then see the following day, on the 18th, the Thursday, she presented as very confused, the record says. Later on in the night, she was seen walking towards the exit doors with a pillow and towel in her hand. When spoken to, she said that she was going to her bed, and she still presented as confused. Now, you were there daily visiting Mags at this point. When you visited the ward, was any of this raised with you?
No.
Were you told at any point during this week about the confusion that Mags was exhibiting?
No. Well, they didn't tell me anything. They didn't speak to me.
During this week, before we turn to the final 3 days, the Monday through to the Monday that week, did staff at any point seek you out to tell you about how Mags was doing?
No. I think the only time they ever spoke to me, I took in a few cigarettes for Mags, and then I was told off at some length for having done so. I mean, it wasn't a packet, it was just 3 or 4 cigarettes. Forgive me.
And so the interaction that you had was effectively you being told off.
Yeah.
And even at that interaction, did they take the opportunity to say, by the way, Mags is struggling, she's experiencing pain?
No.
Any other interaction at that point?
Nothing.
We see then on the 19th of June, Mags is described as in bed most of the morning, still complaining of pain on her right foot, appearing weak, not able to stand for long periods of time. And then on the 20th, it says, Margaret attended the canteen but was wobbly on her legs. Her husband came to take her out to the pet show. I explained to him that Margaret, you may want to turn this up, it's just at page 50 of the records, and it's an entry at 1:38 p.m. on the 20th of June. It says, Margaret attended the canteen this morning but was wobbly on her legs. Her husband came to take her out to the pet show. I explained to him that Margaret was very wobbly on her legs, so I recommended she did not go out as this would be for 46 hours. He agreed. Margaret was informed and agreed with this decision. Can you recall this interaction or what Mags was like on that day?
I can't really. I mean, thinking about it afterwards, it's difficult to see Mags not wanting to go, because it was our two dogs were taking part in this exhibition, and she would have loved to have seen that, but
yes,
she just couldn't face it, couldn't face the movement
and so at the same time as the impression you're being given is that the pain is not physical, it appears from this record that you're being told that she was too unsteady to be able to go out and to do something that, by the sounds of it, she would have really enjoyed.
Yeah.
When this interaction happened, and again, I appreciate this is 10 years ago I'm asking you about, but were you told anything about a plan to address the unsteadiness that Mags was experiencing?
No, nothing.
If we then look at the entry directly above it, this is from 7:11 p.m. on the same day, it says of Mags, she, however, remained in bed until dinner time, when she was repeatedly prompted to attend the canteen without success. She claimed that she was too weak to walk. Staff were eventually able to bring her to the canteen in a wheelchair, where she ate and had some dessert. What is your reaction to the language used there in terms of her claiming that she was too weak to walk?
Yeah, claimed is the wrong word, isn't it? That's what they're saying. It should really be she was too weak to walk.
Yes. And we see then an entry that refers to Mags from the same day, wobbly on legs, codeine given, self-isolative, reluctant to stay in the communal area. Again, is that consistent with your experience of Mags at that time and how she was having to manage her pain?
Yes, I suppose so. It was like she kind of given up trying to be a healthy woman, and there was nothing else. What was the alternative?
We then see, on relation to the 22nd of June, report to have pain in her legs, analgesic given, retired to bed, and then Mags has been escorted to the canteen for meals and has been observed to only have a very small diet. So is it your understanding that during this period not only was Mags very unsteady on her feet and in a huge amount of pain, but she was unable to really eat much at the time? Is that right?
Yeah, well, she had no appetite. I suppose.
And we see then reference to her complaining of pain in her legs, being prompted to wake up and attend to her personal care, needing a lot of prompting, and then again spending the majority of the shift in her bed space with a sandwich brought to her, but she didn't eat it.
Yeah.
As far as you're aware and from what you've seen of the medical records, were any attempts made, putting aside whether there was an initial examination of Mags when she first arrived and was admitted onto the ward, were any attempts made to inspect Mag's leg over the course of this week? Have you seen anything to suggest that?
Nothing.
I want to turn now to Tuesday, the 23rd of June, and I'm going to ask if that entry can be put on the screen. This is at pages 52 and 53 of your statement.
Yes, the 23rd is a busy day.
Yes, and we have here a case note entry which was made by a therapist. And the entry is, at the end of it, dated at 4:54 p.m. on the 23rd, but it relates, and we can see there at the top, to an earlier period. So the entry appears to be relating to 11:50 to 12:15 on that day, so late morning, early afternoon of the 23rd. Is that your understanding?
Sorry, what?
So this is an entry that relates to late morning on the 23rd of June. And we can see...
Where's the entry?
Just, it's also on the screen, if that helps, in front of you.
Oh, right.
11:50 to 12:15. Can you see that? Highlighted on the entry.
Yes. All right.
And we see recorded there in the first line, Margaret was sitting on the floor in the ward corridor and pushing herself along on her bottom.
Yeah.
We see thereafter, one line down, Margaret stated that she has a lot of pain in her right leg and is unable to walk, and asked if she could be taken back to bed in a wheelchair. And then she shuffled into the lounge and independently transferred into a chair. This therapist then describes sitting and talking to Margaret. I sat and talked to Margaret, and she stated that her foot had been hurting her for the last 3 months. She appeared uncomfortable and was moving around in her chair, regularly changing the position of her leg. Margaret's feet were very pale in coloration, and her right foot appeared slightly blue. I asked Margaret about this leg, and she stated that she has bad circulation in this leg, and that she has had this since she had chemotherapy 6 years ago, but that her foot is not normally blue. Margaret transferred out of her chair and sat on the floor, and stated this was more comfortable due to the pain in her leg. And we see there that this therapist then records that they informed the nursing staff of their concerns in regards to the leg, the pain, and the blue foot, and also informed Mags's consultant, Dr. D, of this. And he stated that one of the doctors should be able to see Mags today. And it goes on to set out the advice that's given around elevating her leg and not staying lying down. Now, this obviously was a record that you didn't see at the time. And if we look thereafter on the next page, a supplementary note is created, which was written, it appears, after Mags had been taken to hospital. Is that right?
Yeah.
And this is to clarify the earlier entry as Mags had been admitted to hospital. And here the therapist says, I previously knew Margaret from her previous admissions to Ruby Ward, and I worked on this ward. I'd last seen her when she was discharged from Ruby Ward on the 15th, in April 2015. Whilst a patient on Ruby, Margaret mobilised independently and was independent with all her ADLs, which I think is a reference to activities of daily living. Now, you mentioned previously that the way Mags was whilst she was in the Linden Centre is not how she was previously, when she was previously admitted. Can you say a little bit more about how she had been on those earlier wards, how she'd presented, how she'd interacted?
What, at the Crystal Centre?
Yes, the Crystal Centre.
Yeah, well, I never once saw her lying down at the Crystal Centre. She seemed to be on her feet most of the time there. And she spoke to most of the other patients. I mean, one of them, they did tell me that they were getting, what's the word? They were getting elderly patients who had this...
dementia, is it?
Dementia, that's right, dementia. And one of them kept going up to Margaret, accusing Margaret of having killed her son, which wasn't very helpful. But I mean, Margaret was there and was standing up and I can't remember her complaining of pain when she was there.
And so this individual, this therapist, had come into the Linden Centre and seen that contrast between the mags that he had seen previously and the mags that he was seeing then. And we see the entry goes on. She has previously complained of some pain in her back and some weakness in her legs, but had not expressed to me she had pain in her right leg. I did not observe Margaret's leg to be blue whilst she was on the Ruby ward. And so this therapist was seeing the stark difference, it appears, between not just her presentation, but also the discoloration of her foot at this point.
Yeah.
Is that your understanding?
Yeah.
We see that the therapist has then added some entries in hindsight, explaining that on the 15th of June, I'd observed Margaret independently standing in the corridor awaiting her medication. And then of the 18th of June, I observed Margaret to be mobilising to the canteen with palm-to-palm assistance of 2 members of staff. So clearly less able to move independently at that point. And then on the 23rd of June, as detailed in this note, Margaret was shuffling on the floor on her bum. She bum shuffled to move between chairs. And then they say that they informed the nursing staff that this was not a normal presentation for Margaret. From that, it appears that there is some clear value, is that right, in seeing the difference in presentation between Mags previously and on this admission. Yeah. Do you know whether any efforts had been made by doctors or others on the ward at the Linden Centre to find out how Mags had been presenting or how Mags had been coping when she had been an inpatient previously at the Crystal Centre?
No. What the person who witnessed it, what was his role?
The records indicate, as I understand it, that they were an HCP, a healthcare professional, and it says therapist.
Therapist, yeah.
But is it right that you wouldn't know because this was never communicated to you? Is that right?
Yeah. I wonder if he was. No, he probably wasn't. I was thinking maybe he went to A&E because a male nurse did go to A&E, but I don't think it was him.
Yes, and we will come to that. As I understand it, there isn't anything in the records or from your statement to indicate whether that is the same or a different person.
Yeah.
We then see...
But it's nice to come across somebody who remembered Margaret from before and could compare her with how she was now.
I'm looking at the time. I wonder now whether now might be a good moment for a break. Tim, would that be a suitable moment for you to break? And Chair, is that a suitable moment to take a break?
Yes, I'm conscious of time, so I think it must be just 10 minutes. If
Yes.
that's all right.
10 minutes.
Okay.
Thank you. Thank you, Chair. Tim, we were just talking about the 23rd of June, 2 days before Mags was then taken to A&E. And I wanted to just take you through one or two points that are in the medical records that you have included and extracted in your statement. There is reference there to doctors being asked to review Mag's legs. Is that your understanding? That they were asked at this point, following the therapist observing Mags himself to review. And is it right that on the afternoon of the 23rd of June that you visited Mags that afternoon?
At the Linden Centre.
At the Linden Centre, yes.
Yeah.
It may help. In the records, there is reference to PM, referring to the afternoon, has been encouraged to eat small amount, visited by husband. And so it appears from the records that you visited Mags on that afternoon.
Yeah, well, I probably could do. I don't remember anything specific for that occasion.
We know now that that was after the therapist had made these observations and raised these concerns that they had about Mags.
Yeah.
On that day, did anybody, when you visited Mags in the afternoon, attempt to speak to you and convey what was going on in terms of Mags's foot being blue, the concerns in terms of her pain, any of that?
No. And just something that occurred to me that, I mean, it's more than once that it says that they went to A&E.
Yes.
But in fact, she only went to A&E once. But it seems to move around, like they're not sure when she did go to A&E.
Yes, it may be when we talk about what happens on the 25th of June, there is reference to referring her to vascular surgery and taking her to A&E, and it may be that it is clearer at that point.
Yeah.
We can move now to the 24th of June, but before we do that, there is a reference I just wanted to take you to at page 56 of the records. The entry itself is a risk assessment and plan, which is dated the 25th of June, so 2 days later. But if you look at page 56, there is reference there to Margaret has reported that her right foot is painful and has been struggling to walk on this. She was seen on the 23rd of June 2015 by the on-call doctor who reported that he would be making a referral to surgery as the foot was blue. However, she was able to feel her feet and was able to identify which foot was being touched when she was not looking at this. And so it appears, is this right, that Mags may have been seen by an on-call doctor on the 23rd, but she was still at the Linden Centre when you saw her on the 24th and wasn't taken as an urgent emergency patient until the 25th. Is that right?
Yeah.
And so I want to turn now to Wednesday, the 24th of June, so the day before Mags leaves the Linden Centre. And I want to look at an entry on page 54, so back 2 pages in your statement, where we see towards the middle of a page an entry, week commencing 22nd of June, weekly planner, Wednesday. So this is the 24th. She complained of pain on her legs. PRN codeine 30 milligrams was given. She slept through the night. And then of the morning, orchestrating and manipulative in behaviour, illegible, is deteriorating. Re-bed sores, rang husband to complain about us, not letting her lay in bed. And then PM, the afternoon, orchestrative, can't stand up, putting self on floor. And I think you made reference earlier to this particular record. You had mentioned orchestrative.
Yeah.
I want to just focus on the language that's being used here, orchestrative and manipulative in behaviour.
Yeah.
Seeing this record much after Mags's death, what was your view of that entry and what it said?
Well, it's not Mags. I can't imagine her being manipulative. I wonder what the illegible is. Is it just joking?
Yes, I think illegible has been written. If you look at the top of the entry, difficult to read some entries, but it, clearly the full record isn't there for you to see.
Well, I mean, it's a strange thing to write.
Yes. We see their reference as well to rang husband to complain about us, not letting her lay in bed. Can you recall receiving a phone call from Mags in relation to her pain and her feeling that she needed to stay in bed?
No.
We then see an entry that refers, just at the bottom of that page, she was later observed walking to the toilet but felt unable to walk back to her room. Staff assisted Margaret to the shower and helped her see to her personal care. And so, is it right, your understanding, it appears that quite close attention is being paid to when Margaret is able to walk or isn't able to walk at this point, and the records are clearly setting that out in some detail.
Yeah.
We then see an entry on page 55 at 3 p.m, which says, she stated that she was not feeling very good. I asked Margaret how her legs were, and she said still painful. I asked Margaret how has her mobility been, and she did not answer me. But another patient who was beside her stated that she has been having assistance from the nursing staff to mobilise. Margaret asked if I could get her some water, which I did. Margaret did not appear to be in as much discomfort as yesterday when I saw her, as she was sitting more still in her chair and was not verbally expressing being in pain. She also did not place herself on the floor. And so it appears from this, is this your understanding, that other patients were raising their own concerns about Margaret or expressing concern about her having had assistance?
Yeah, yeah.
And there's also their reference to not verbally expressing being in pain. I think you had mentioned that she was struggling to articulate the pain that she was going through. Is that right?
Yeah, yeah.
On that day, this is the last day on which you visited Mags at the Linden Centre, is that right? The 24th, the day before she was taken to hospital?
Yeah. Yeah.
And in your statement, you described the visit you made to Mags. Can you recall how Mags was when you saw her on that afternoon?
Yeah, well, that was the time when she was lying on the sofa.
Yes.
In the television wasn't a room, it was just a screen was there somewhere. And she couldn't move at all. She was trying to stay as still as she could on this chair. I mean, it's kind of like a small sofa. And there were a couple of other patients there. Well, it says that, doesn't it, somewhere? That other patients had seen her.
Yes, I think you refer to another patient being there in the communal parts.
Yeah.
And saying that she'd been trying to get the nurses to take Mags to A&E. Is that right?
Yeah. Yeah.
When you arrived, other than patients being around, did any member of staff come and speak to you?
No. I mean, remember this was, and then the following morning I rang up to get an appointment with somebody.
Yes, and so this is the occasion when you, before you leave Mags, try and speak to the ward sister, I think you said, and go to the office and attempt to speak to her at that point. Is that right?
Yeah.
And you said, I think, that it was chaos. Is that right?
Yes. Yeah.
Can you explain a little bit more who you remember being there and whether you had any interaction with anyone at that point?
I didn't have any interaction. My memory of it physically is a bit strange. I imagine looking down on the ward sister's office, which was completely transparent, and you could see the number of people inside the office. And you could see there was a lot of people just outside the office waiting to go in the office. And I'm pretty sure at some point they actually locked the office door to stop more people going in. And I thought, well, I'm never going to get in there.
So you've told us you gave up.
Yeah. Yeah. Well, I mean, I rang the following morning in order to demand an interview with somebody.
Yes, and there is reference in the records you've included to, by this point, Mags being incontinent of urine and faeces. Was this toileting difficulty something that she had had as a long-term problem, or was it something that had happened over the course, as you understand it, of her time at the Linden Centre?
Yeah, as far as I know, it was only in the Linden Centre. We didn't have it at home.
And again, this is not something that was raised with you or communicated to you by the Linden Centre?
No, but I mean, it contributed to Margaret's depression because it's embarrassing. She's not used to it. She's making a mess. How can she clear it up? She can't clear it up, etc., etc. It's bad.
And then turning to the 25th of June, we see in the records that at about 1 a.m. a senior house officer who is on call, this is at page 55, the same page, that he is asked, or she is asked to see a patient with purple legs, and noted by staff this evening, no pain associated according to Pat, which may be a reference to patient, and then on examination, no abnormal colouring noted of legs by lat and peripheral pulses palpable, with at the end what appears to be review, illegible words, if further concerns. Is it your understanding that certainly it is not until later on the 25th that there is urgency in the approach taken to Mags's physical decline.
Yeah, I mean, who is making these comments at 1 o'clock in the morning?
And is it right at this point that you have a large number of unanswered questions, including that about what happened to Mags during this time?
Yeah, well, I mean, purple legs is quite clear.
Yes.
Lesions noted at the bottom.
Yes, that may be the circle with the line through it, a note to indicate no redness, arrhythmia. But again, it's not something that you would know from that medical record. Is that right? I want to turn now to a couple of entries in relation to what happens on that morning with Mags, and we see on page 56 that there is reference to her remaining in her bed from the start of the shift. She declined to get up, and staff assisted Margaret to attend for medication, which she did. She's then assisted to change her incontinence pad, and then she's assisted into a review with consultant psychiatrist Dr. D, and Dr. E recommended that due to her declining mobility and discoloration in her lower legs when standing, she be referred to A&E for further investigations with the vascular team. And 2 members of staff assisted Margaret in her wheelchair to A&E. Do you see that?
It's the second box up
from the
bottom of page 56.
All right.
Apologies. Yes, it's just where it says 1443.
Yeah.
It's that entry there, and you see in the middle of it, she was then assisted into a review with consultant psychiatrist. And what I want to do is just come to the next entry, which is that interview that they had with Mags, which appears to be the last communication with her from these records. And Amanda, if that could be put on the screen, it's an entry that starts on page 56, but we're going to look at page 57, wherein it'll come up on the screen, Tim. There's an entry, just to turn to page 57, where it says interview with patient.
Yeah.
And we see here, Margaret said that she feels very, very unwell. My legs hurt, and this has been for well over a month. I feel shaky, and I feel, to be honest, it feels like a nightmare. And so this is an entry that appears to be, is that right, the meeting that is held between the consultant psychiatrist and others with Mags. She says, it's just being able to bring one leg up against another. I do feel that I don't have any power. In the beginning, it was quite painful. I went on holiday and I walked in some sand dunes and damaged my knee. It was about 3 to 4 weeks ago. I wish I wasn't here. My mood is quite low. Eating and drinking is always difficult. I have no appetite. I can drink. Dr. E told Margaret that we will get her leg looked at very quickly. Margaret said that everyone is kind, but it is too much of an effort for me, and I appreciate that I'm not a good patient. I would just like to rest. And so that appears to be the last record from Margaret, or Mags's perspective, and what she says in the records in relation to the Linden Centre. Is there anything you would wish to say about that entry and about what's said there by Mags?
I think, Margaret, she did do quite a lot of work in the NHS, and she knew how much work they were doing, and she just wanted them to know that she appreciated whatever it was that they did. She couldn't make anything specific because there wasn't anything specific, but She knew what being an NHS nurse could be like. Not knowing everything, not knowing much.
And then by the time that Mags arrives at A&E, we can see from what you say in your statement that she appeared clammy, had to be taken to a resuscitation ward, given a heat blanket and an oxygen mask.
Yes, now she's in the physical world. She's left the mental world.
Yes. And when Mags was moving to A&E, before she did that, did you receive any call or communication from the Linden ward to tell you that that was happening?
Well, I was there. I went to A&E.
Apologies, that's my misphrasing.
Yeah.
When she was being moved to A&E, so this is around 1:07 p.m., this is the early afternoon,
Yeah.
we can see in the records there's reference to husband informed coming up this afternoon.
Yeah.
Did you receive a call from the Linden Centre to tell you Mags is very ill, Mags has been taken to A&E?
No, I rang them. I was trying to get an appointment with someone senior. And the bloke who answered the phone
Yes.
said, well, funnily enough, she's just gone off to A&E.
And in that phone call, was more said to you about the state that Mags was in?
No.
And so at that point, you made your way as quickly as you could to see Mags
Yeah.
and A&E, is that
Yeah.
right?
Yeah. I mean, maybe he didn't exactly say, funnily enough, but I mean, that was his attitude. It was a coincidence that I should have rung at that time.
And do you know how long had elapsed between the funnily enough or the coincidence of you calling and when she'd left for A&E?
He gave me the impression that she was almost on her way then. And how they got, I think they got an ambulance in the end. Although it does mention wheelchairs.
Yes. From the records you've included, it may be that she is escorted by 2 members of staff to A&E, but she then, of course, does a transfer by ambulance to the Princess Alexandra Hospital later that day, which is it your understanding from the records, was blue lighted, so was very much an emergency move.
Yeah.
Once you arrived at A&E at Broomfield Hospital, which you say in your statement was at about 2 p.m.,
Yeah.
you say that your understanding for the significant effect on Mags's mobility was that the right leg was cold, pale, and had no pulse, and the diagnosis made at hospital was acute limb ischemia of the right leg. Is that correct?
Yes.
And you say that you remember the doctor at A&E being pretty disgusted that Mags had been allowed to go so long without treatment. Is that right?
Yes.
Can you recall what was said, what happened during that conversation, or if anything specifically was said by that doctor?
I think he'd just seen the scan results. And I kind of see him maybe not necessarily speaking to me, but just saying, you know, this is terrible, look at this. How long she been like that?
And is it right that there was originally a nurse who was accompanying Mags and yourself, but there was a swap for another nurse?
Yeah.
And that when that nurse attended, they also expressed some concern about how long Mags had been left. Is that right?
Yeah, he did. I think he got in a lot of trouble for it as well.
Yes, I think you say in your statement that a young male nurse replaced another nurse and confirmed that the nursing staff had been told not to take Mags's complaints seriously.
Yeah.
Is that right?
Yeah.
And that in the end, it was a fellow female patient who made such a fuss that somebody finally took a look at Mags's leg.
Yeah.
I think you mentioned getting into trouble. I think, is it right that you later received effectively an apology that he shouldn't have said that to you?
Yeah.
From what was then NEPT and now is EPUT, is that right?
Yeah, yeah.
And it's something that you understand him to have got into trouble for saying, for being frank with you and telling you what had happened.
Yeah.
I want to just briefly touch on another concern you have that is connected to Mags's physical health, but is about aspirin and whether Mags was being prescribed and receiving aspirin during her time during these 3 different inpatient stays.
Yeah.
And is it your understanding that during the first of those inpatient stays at the Ruby ward at the Crystal Centre, Mags was being given aspirin? Is that right?
If that's what it says, yes. I mean, I trust the notes from the...
Yes, and it appears from the notes that aspirin is recorded as both a medication she's receiving on admission and also one she's receiving at the end of her period of admission.
Yeah.
Is that right? And then we also see that during that first period of admission, Mags has her antidepressant medication changed from paroxetine to venlafaxine.
Yeah.
And so it appears, is this right, at the end of her time, her first admission to the Crystal Centre, she was receiving aspirin and venlafaxine at the same time.
Yeah.
If we look then further forwards to her next 2 admissions, is it right that there is no reference to Mags receiving aspirin in either her pre-admission, during admission or post-admission for both her second stay at the Crystal Centre and also her stay at the Linden Centre?
Yes, I mean, I wouldn't normally have known that, but I mean, I've looked it up, and that is the situation. I mean, to begin with, I didn't realise the relevance of aspirin to vascular conditions.
And is it right that that's something that was raised by Dr. F, Mags's good friend?
Yes.
And he gave you an appreciation that this may be something to look into?
Yeah.
In terms of beyond the medical records, what was your understanding from Mags as to whether she was taking aspirin over this period of time?
I don't know. Mags's father was a chemist, and Mags knew quite a lot about pills. I don't actually remember her talking about the significance of aspirin.
Yes.
I mean, even saying that now, I think maybe I did, but I'm not sure.
If it assists, I think there is one reference in your, which you've included, the extract from your evidence session with Emmy, where you explained that, in fact, when you asked Mags whether she had had any aspirin, she thought it had not been for some time.
Yeah.
And that is when you were at hospital on the 25th of June.
Yeah.
I want to turn now to just generally the topic of communication on the 2 separate wards that you have experience of. So how Mags was communicated with in the Crystal Centre, the Ruby ward at the Crystal Centre, and what your view is of what efforts were made by those on the ward to speak to Mags.
Yeah.
So staff, and what her interactions were like from your memory when she was at the Crystal Centre.
Well, what I remember most, and most immediately, was I was driving my car back to home in Tolsbury, and I drove past Mags and another woman, and that was the nurse from the Crystal Centre.
Yes.
And they were just walking around Tolsbury, because Mags was depressed with Tolsbury. And the nurse gives a little summary of how Mags was on that trip, and thankfully Mags got to the fruit and vegetable stall in the square, and more than one person shouted out, "Hello, Mags." I've got to say something in defence of Tolsbury, but Mags was a London girl.
Yes.
And she found it difficult to adapt. Yeah.
But it sounds like, is this right, that she had quite positive relationships with the staff while she was at the Crystal Centre?
Yeah. Well, that's what the staff came out and actually walked with her around Tolsbury, which I was surprised about.
And contrasting that with Finchingfield Ward, which is the Linden Centre, what was your impression, if you had any opportunity to see it, of the relationship between Mags and the staff on that ward?
I don't remember Mags in connection with any staff there while she was there. It seemed like just nothing was kind of under control. So, I mean, I can imagine a senior person wanting to say something to Margaret, but not being able to get there, being interrupted by so many other things. It was everybody seemed to be on the move. No one was settled.
And I think you described the Crystal Centre, and certainly the Ruby Ward there, being one with older patients, whereas the Finchingfield Ward, which you know as the Linden Centre, had younger patients. Was it your sense that the Linden Centre didn't necessarily know how to support Mags, or was it just that it was so busy that there was no real interaction with her from the moments when you were there and you observed it?
Yeah, I think just there was no interaction. I mean, I'm trying to see in my head a staff in uniform next to Mags, and I don't. There's nothing there.
And in terms of activities, you say in your statement, from the extracts from your evidence session with Emmy, that when you visited Mags at the Crystal Centre, often you would just sit and she would just, in the Linden Centre, she would just lie with you, and you don't know if there are any day-to-day activities going on in relation to Mags. Is that right? Were you aware of anything being planned for Mags in terms of day-to-day activities?
No.
In terms of staff engagement with you as her family, just to summarise and ensure that I understand this, is it right that between that meeting you had on the 15th of June with Dr. C, Dr. D, apologies, and the other staff, was there any interaction other than this incident where you were told off and bringing in cigarettes, and this incident when you were told you couldn't take Mags to the pet show?
Yeah.
Was there any interaction with you at all when you visited from staff, as far as you can recall?
No.
Contrasting that or comparing that with your experience at the Crystal Centre, when you visited Mags there, do you recall having interactions with staff?
Yes. I can't remember whether they talked about what they were going to do with Mags, but they were quite pleasant and told me how Mags was getting on.
Yes.
And whether they were, well, they were quite happy with her there, but if there were any difficulties, they would have said.
And in terms of other means of contact, you've told us that you called on that final day, but in your extracts from your interview, your evidence session with Emmy, you say, I thought at the time the fact that these telephone numbers that we were given, we were assured that we would get an immediate response, but we got no response at all. And the question is asked of you, so you're given an emergency number to call if you need urgent response, and you're told, if you call this, you'll get an urgent response, but when you do, there isn't one. And I just wanted to ask about that. Had you attempted to call the Linden Centre whilst Mags was staying there and found that you couldn't get through?
No, I was at home with Mags.
I see.
And we were ringing those numbers then, numbers that we've been given.
I see.
With the promise that we'd get through.
So this is the crisis numbers that were available, so that if Mags needed admission or needed an assessment or further support, that would be available to her quickly. Is that right?
Yeah. Well, I mean, she needed them then.
Yes.
That's why I was looking for them. But all three of them. One didn't answer at all. One just had a mechanical answer. And I left messages but got nothing back.
And we've addressed the call that you had on the 25th of June. Is it right that after Mags had left the Linden Centre, you returned to the Linden Centre to collect Mags's belongings? Is that right?
Yeah.
Can you say a little bit about what happened when you returned to the Linden Centre?
Yeah, well, I went in and I said I've come to pick up Mags's stuff, and someone said it's down there somewhere, and I went and picked it up, and on the way there I passed a couple of members of staff, and I felt a bit guilty that they might think, what's he doing here?
Yes.
But I carried on and got Mags's stuff and took it away with me. But nobody asked me how Mags was. Nobody mentioned her name. And that crops up again here as we move on page 59.
Just turn to page 59.
In the left-hand column,
yes,
the initials and the dates and the times.
Yes.
They go on to the 7th of the 7th of June.
Of July, just below. I see that at the bottom of the page.
Yeah. So 4 days after Mags had died,
yes,
whoever wrote this either got an email from someone at Harlow saying Mags had died, or thought, I haven't seen Mags for a while, I wonder how she is, I'll ring Harlow. And they told her that she died 4 days later.
Yes, we see in that entry, it says, I made a telephone call to Princess Alexandra Hospital in order to make further inquiries. Yeah. After being informed via email by Dr. D that Margaret had passed away. I was informed that Margaret passed away on the 3rd of July, so yes, as you say, 4 days earlier. They did not inform me the cause of death. And it then says, tried to contact Margaret's husband on landline, but there was no answer. And again, at the next entry, I tried to contact Margaret's husband again today in order to pass some condolences, but there was no answer. Did you receive a call from the Linden Centre?
I don't remember, no. No.
You never spoke to them. If you received a call, it never reached such a point that you actually had a conversation with them, is that right?
No.
And what you just told us about your experience of going into the Linden ward after Mags, to collect Mags's stuff, was that before Mags had died or after?
No, it was before she died, yeah. Maybe the day before, 2 days before. So she wasn't, I don't think she was at death's door then.
And you talk about that in your statement, and you say that you went to the Linden Centre to collect her stuff and nobody said hello to me and just said, oh, it's over there, her stuff. No one asked how she was. I remember that it was kind of enemy territory and I wasn't welcome.
Yeah.
Is there anything further you would want to say about the engagement and communication that you had with the Linden Centre?
No, I don't think so.
I want to turn now to your concerns regarding what happened following Mag's death. We've discussed already that immediately following Mag's death there were, in the records, 2 attempts to contact you, but there was no contact actually made with you by the Linden Centre.
No.
And it's right that there was no inquest in Mags's case, is that right?
Yeah.
And so the process of receiving answers through that process, you have not had the opportunity of, is that right?
Yeah.
Turning to the communication you had with what was then NEPT but is now EPUT following Mag's death, there's reference, and we will come to the letter that you wrote to Mags's good friend, Dr. F, the letter you then sent to the Trust. But before the 25th of July, in few weeks just following Mag's death, were you reached out to by the Linden Centre or by the Trust at all? Before you made contact with them?
I did have a conversation with someone from EPUT, and they just they'd rung to see if I needed some support, but that was it. There was no mention of Mags's death or how she died. It was just me. What did I want?
And can you recall whether that was before you'd sent your letter of complaint, which I think was in the August?
Yeah, that was before, yeah.
And so is it right that you set out in your statement that on the 25th of July, shortly after Mag's death, you wrote to her good friend and a former colleague from the time when she was working as a medical secretary at the Brompton Hospital.
Yeah.
And that he advised that you raise concerns that during Mag's stay at the Linden Centre, she was not assessed thoroughly as to her physical pain, that this resulted in a delay in diagnosis and possibly life-saving intervention, and that you articulate concerns regarding her usual treatment, including pills such as aspirin. Is that right?
Yeah.
You were encouraged to make a formal complaint, and you wrote to the Trust in August of 2015, and you have set out, as I understand it in full, is that right, your letter to the Trust on pages 108 to 111 of your statement. Is that the full letter that you sent?
Yeah.
you had been advised by Dr. F to write to the consultant Margaret was under and copying in the hospital chief executive, PALS, consultant at Princess Alexandra, the consultant at Broomfield A&E, the consultant Margaret usually saw, and the GP. It isn't clear from the letter in the statement who your letter was sent to. Given the advice from Dr. F, do you recall sending it to those people that he had advised you to send it to?
No, I don't think I did.
Okay. Can you recall who you sent it to?
No.
Not to worry.
Probably the highest ranking. I was just fed up with the whole thing.
Yes. Turning then, just in relation to the letter that you sent, did you receive a response to that letter?
No.
From the Trust?
No.
You've explained that you received some communication, but it wasn't talking about what had happened to Mags and how she had died, or suggesting that there would be an investigation. Is that right?
Yeah. Yeah.
And so, is it right, you say in your statement, that no investigation, as far as you were aware, was carried out by NEPT into Mag's death or the management of her physical health on the ward? Is that right?
Yes.
And when you heard about the Essex Mental Health Independent Inquiry, you say you decided to engage with it in order to try and get answers for what happened to Mags. Is that right?
Yeah.
And similarly, you go on to say that it's the same reason, trying to get answers to Mags, that is the reason why you have therefore sought to pursue civil litigation. Is that right?
Yeah.
You say then, towards the end of your statement, at page 121, it's now been over 10 years since my wife's death. I've not received answers with regards to all of my significant concerns about the care she received and did not receive. Is that right?
Yeah.
You say also, and this is at paragraph 12G on page 100, I feel that the suffering which Margaret went through whilst under the care of EPUT, which was then NEPT, has now, after her death, been passed on to me whilst I seek answers about her death. There appears to have been no willingness to do the right thing and learn. It is defensiveness from beginning to end. Is it right that loved ones trying to get answers need to have so much stamina and resilience to do so? Is there anything you'd like to add to that point?
No, I don't think so.
I want to turn finally then to recommendations that you make in your statement. We'll go through the recommendations set out in your witness statement, and I will ask if there's anything further you'd like to say about those. If we can, Amanda, have up page 100 of the statement. And Tim, this is page 100 of your statement, and it's towards the top of the page and highlighted in bold. At the second paragraph down, you say, this leads to a recommendation that I would like to make to the inquiry. When inpatients in psychiatric wards have medical, surgical issues, in addition to their psychiatric issues, there must be an initial and ongoing review of these conditions on the ward. Is there anything further you would like to say about that recommendation?
No.
And then if we turn to the bottom of page 120 of your statement, again, this is an extract from your evidence session with Emmy, and we can see at the end of the extract, you were asked, do you have any recommendations or things that you think should change? And I just want to ask about the reply that you give there. I think if everybody knew what treatment they were getting, other than pills and medication, what other treatment they were getting and what they hoped to achieve through it, that's the main thing. And I would have thought, given the circumstances and the security and everything else, then there must be opportunities for the inmates to be able to achieve something together. So first thing there, what are the, other than pills and medication, what are the treatment they're getting and what they hope to achieve through it? Are you talking here about therapeutic treatment or just treatment more generally?
Well, therapeutic and generally.
And medication?
I mean, generally may include therapeutic.
And is there anything further you'd like to say about this particular recommendation?
No.
And in the next line, finally, you say, I would have thought, given the circumstances and the security and everything else, then there must be opportunities for the inmates to be able to achieve something together rather than as separate individuals to be able to help each other. Because I think a lot of them did want to, but they found it difficult, like the woman who tried to help Mags. Is there anything additional you'd like to say about that recommendation?
No. No.
And are there any further recommendations you wish to highlight in light of this or anything else that we've discussed?
I've just been thinking recently about this isn't perhaps answering it, but the difference between the mind and the body.
Yes.
Because all what we're talking about, you've got one organisation representing the mind and one representing the body, and when they come together, they've each got their ideas about how to make the patient better, but they don't seem to blend particularly well together.
Yes. Is there anything further at this point that you would wish to say?
No.
Thank you, Tim. I don't have any further questions for you at this stage. Chair, do you have any questions?
No, I don't. Thank you.
Amanda, please can we have the photograph of Mags on the screen?
She's the one on the left.
And that's a much younger you.
Chair, we will break for 10 minutes. If there are no further questions for this witness, we will then start the pre-recorded evidence of Emma Harley. Tim, we will have the 10-minute break now to see if there are further questions. And if there aren't any, this concludes your evidence and you will be free to leave. Thank you again for the evidence you've given today.
Can I add my thanks to your evidence? Very, very helpful. Thank you.
Chair, thank you. We are now going to hear the first section of pre-recorded evidence from Emma Harley, who will be speaking about her brother, Terence White, who died in 2019. And due to the time, our plan is to play the first section now up until about 5:15 and the second section of Emma's evidence tomorrow morning. Amanda, if you could play the video, please.
Good morning, Emma. I think you're going to affirm now.
I, Emma Louise Harley, do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth and nothing but the truth.
Emma, you gave a video recorded commemorative account which was played on the 16th of September of 2024 regarding your brother Terry. Terry died on the 14th of April 2019, aged just 36. He died at home and his medical cause of death was hanging. You're here today, Emma, to give evidence about your concerns regarding his care. You've provided a 63-page witness statement. It's dated the 5th of August 2025. Have you had an opportunity to read your statement recently?
I have, yes.
Thank you. Can you confirm that the contents are true and accurate?
Yes.
Thank you. Now, I'd like to start by asking you, in terms of background with regards to Terry. He had a diagnosis of ADHD, attention deficit disorder, at the age of 17. Is that right?
Yeah, that's when he was finally diagnosed. For years we knew there was something, but obviously back then we didn't know what ADHD was.
And can you tell me whether he was medicated for that diagnosis or not?
He wasn't, no.
And do you have any observations that you perhaps want to make about his diagnosis of ADHD and what impact that might have had on his adult life?
Yeah, I think the symptoms progressively got worse the older he got. And I think he began to self-medicate in his teenage years. And then that obviously made the ADHD symptoms even worse. And he sort of really spiraled and things got worse as he got older.
Okay. And we'll come on to the point that you made about self-medicating in a moment. Terry had periodically been assessed by the mental health services and the community and drug and alcohol services between 2000 and 2008. Is that your understanding? So that was under NEPT and SEPT at the time. Is that your understanding?
Yeah, that's correct, yeah.
And just help us, if you're able to, summarise how Terry was between that time, between that 8-year period, 2000 to 2008, when he would have been in sort of late teens.
Yeah, it was late teens were quite a tricky period for him. I think that's when we all realised that this was actually quite serious, that the ADHD had possibly turned more serious or maybe sort of tipped over the edge into being something else. There were lots of paranoid and delusional episodes, lots of episodes where it appeared he was psychotic. And yeah, that was the beginning of things getting worse.
Okay. Now, in your statement at paragraph 5, page 3, I'm going to ask that that's displayed, really to help you in terms of the chronology. At paragraph 5 on page 3, the records show that there was no contact with trust services until 2016, and it was then that he had contact with the Rapid Assessment Intervention and Discharge Team, the Criminal Justice Liaison and Diversion Team, and the First Response Team. Does that accord with your recollection at that time around October 2016?
It does. That was the month that his mum died. So the lead up to that was obviously very distressing for Terry, and obviously the bereavement, the grief after she died, he got a lot worse. I do question whether there was no contact with the trust before October 2016. Looking back, I don't think there were periods of years where he was okay. So I think there must have been contact with GPs and possibly more. Whether that's missing in the records, I don't know.
Just give us then, from your perspective, some insight into how Terry was. So we've talked about how he was between 2000 and 2008. From your recollection, how was he up until the point that sadly his mother passed away in October 2016?
So there were periods of calm. He had his eldest daughter, and he was in a stable relationship. So definitely periods of calm, not completely out for the woods, but definitely periods of calm. But also it wasn't that plain sailing. You know, I think there were various meltdowns, various episodes where he would have gone to A&E, possibly for misadventures and those kinds of things.
When you use that word misadventures, what do you mean by that?
Accidental self-harm. I remember an incident where he was taking steroids and they think that caused a minor stroke. I remember I was 6 months pregnant at the time with my eldest and had to go to hospital in North London. So yeah, there were a few incidents.
And so in October of 2016, would you say that there was a change in his presentation then?
Definitely. I think before October 2016 as well, about the time we found out that his mum had cancer. Rapid deterioration.
And just put it into context for us. What was that rapid deterioration? How did that manifest?
Obviously, with lots more incidents of self-harm, suicide attempts, visits to A&E, overdoses, police attendances. There was lots going on at the time.
I think I'm going to ask you about a specific entry. So if you have a look at page 3 of your statement, sticking with page 3 of your statement, paragraph 7 at the bottom of the page there, there's a reference, just to help orientate you with regards to dates, the 10th of October 2016. And if we turn over the page to page 4, we can see that this relates to an incident on the 10th of October 2016, where Terry attended Basildon and Thurrock University Hospital's NHS Foundation Trust, I think the Accident and Emergency Department, following an overdose. Can you recall that?
Yeah, I can. This is one of many incidents of him, I think, essentially self-medicating. And I think if you look at the kinds of drugs he was taking, it was to calm his mind right down.
And is that what you mean by saying self-medicating?
Yeah. I think he was massively spiralling. He was very unwell around this time. And he was trying everything. He was asking for help from everybody, and especially the NHS, and it wasn't there.
And so is that when, around the time that his drug taking started?
No, his drug taking started a long time before that, in his teens.
Okay. It says here at paragraph 8, history of smoking cannabis, had 2 lines of cocaine last week. And were there any other drugs at this period of time of Terry's life that he was taking, or as far as you were aware, were these cannabis and cocaine that he was taking?
No, he was taking diazepam, pregabalin, I think that's how you say it, tramadol, Oramor for obtaining drugs illicitly as well. And he also, it was around this time that he, I think after the hospital admission on the 15th of January 2019.
I think we'll come on to that. I'm sorry to interrupt you.
But just talking about the drugs,
Yeah.
he then started doing crack.
And that came later, you say, in January 2019.
Yes.
We're going to come back to that incident. But just going back in time, talking about the cannabis and cocaine that he was taking and the other medications that he was obtaining illicitly, are you able to help us understand and put into proper context what impact, if any, taking those illicit substances or substances obtained illicitly were having on Terry in terms of his as someone living with mental ill health?
Yeah, I can understand. I can see clearly why he wanted to take those drugs. He was very mentally unwell. His brain was all over the place. He struggled to cope with daily tasks, with daily life. Like a neurotypical person, it was very difficult for him. He also had lots of, there was talk of a possible diagnosis of OCD, talk of a diagnosis of personality disorder. I knew he was struggling mentally. He found it very difficult to cope. So in a sense, I think the diazepam and different drugs helped him to calm down. I think there were some that were beneficial. I don't think the amount he was taking was beneficial at all. But obviously things like cocaine, not helping him at all. Yeah. So it's a bit of a weird one. So in some respects, I think he needed them and it was helping him, the ones that would have been prescribed legally. On the other hand, the other stuff he was doing was not helping at all and making him worse.
I'd like to ask you to have a look at paragraph 9, page 4 of your statement, just to help orientate you in terms of dates. We can see here a reference in italics to the 11th of October 2016. Can you see that?
Yep.
It appears that this was a prompt that led to Terry being referred to the Rapid Assessment Intervention and Discharge Team. So I'm just going to read it out. Mm-hmm. It's a letter that says, from a psychiatric liaison service mental health unit, Basildon Hospital. The date of the assessment is the 11th of October 2016. It then says, thank you for referring Terry to the RAID team. That's the Rapid Assessment Intervention and Discharge Team. Terry was admitted following a mixed overdose, which he claims at the time was taken with suicidal intent. He now regrets his actions. He said it was an impulsive act done out of frustration because so many things happened within a short space of time and it all just got on top of me. It then goes on to give a description of of the clinical impression, presumably that's from the psychiatric liaison service at mental health team, that this was an impulsive overdose. Terry does not feel that he needs the input from mental health services, would like some help with his, says ADHA, I think that's ADHD. And then it says the management plan, discharge from RAID, refer to GP for referral of management of his ADHD, it says there, partner to ensure compliance with medication. And then there's a discussion about his sertraline to be reviewed, and crisis number / information given, signed off by a psychiatric liaison nurse. Clearly this entry here on the 11th of October 2016 makes reference to Terry undertaking an act with suicidal intent. Can you just help us and put into context from your perspective what you understood about Terry's instances of self-harm and whether he had expressed suicidal ideation to you and family members?
He had, and this was a constant theme throughout his adult life. He would, because of mounting social stressors and the fact that he was unable to cope with daily life led him to these very dark places where he kept thinking that the only option was suicide. His ADHD also meant that he acted very impulsively. So it was like he had the thought, everything's going wrong, and he couldn't cope with the thoughts in his head, which is why he constantly talked about suicide and ending it all. We did take him seriously. However, you never think it's actually going to happen. Yeah. If he'd have been looked after properly as well and been given the correct care, I think this could have been prevented.
We'll come on to talk more about that now. So I want to move on in time to December of 2017. And if I could ask you to have a look at page 5, paragraph 10. Page 5, paragraph 10 of your statement. It's an entry, the 3rd of December 2017. Can you see that?
Yeah.
And this is another instance of an overdose, and I'm just going to read out extracts from it. This is again Basildon and Thurrock University Hospitals NHS Foundation Trust, an entry from the 3rd of December 2017. Terry presented with an overdose. It says that he's medically fit for discharge and due to be seen by the mental health team. It then goes on to say that on this occasion he managed to break a cupboard, and that he accepted that he had managed to break open a cupboard. And then there's an entry that says, patient's sister and a friend, concerns regarding patient. They said that he can become very aggressive, and he texted them that once he is out of hospital, he is something illegible to self-harm. And then the next entry at 1950, family worried about patient getting self-discharged. Will need MCA 2+ dolls if patient attempts to self-discharge as high risk of suicidal ideations. Was that you that this entry is referring to?
Yes, yeah.
Can you tell us about that incident?
As I'm reading this now, I'm quite shocked to read, as part of their medical notes, he is medically fit for discharge. When he's talked about, how he's been extremely aggressive. He's talked about, it says high risk of suicidal ideations. And I cannot believe that there is that line in there, medically fit for discharge, after the way he was presenting.
I think that's in respect of his physical health, though. That's a reference to his physical health, and at the top it says he was due to be seen by the mental health team. I don't know if that helps put that into context, but was this another occasion where Terry had attempted to overdose?
Yeah, it was, and sort of reading through all of this, it's hard to keep track because there were so many incidents.
I'm going to move on to another now. So at the bottom, towards the bottom of this same page, page 5, 5th of December 2017, it says here, paragraph 12, there's an entry with regard to an intentional overdose. What it says towards the bottom, that there was a background history of depression, no current contact with our service. He consented to raid assessment and for staff to speak on the phone to his sister Emma. Just pausing there for a moment, was Terry happy for mental health professionals, for example, to speak to you? Did he consent to that?
Yeah, every time he would say to doctors and nurses, please speak to my sister Emma, because I think he felt I don't know, perhaps understood his problems better than he did. He was too much in his own head that it was very difficult for him, I think, to articulate exactly what was going on for him. And he knew that I could get him help. Well, could try to, anyway.
I think, just to put this into context, I think this entry, albeit it says the 5th of December, I think it relates back to the 3rd of December.
Yeah.
And then it says at the very bottom of that page, overdose was impulsive. He felt fed up about things that have been going on in his life. Over the page 6, now saying he regrets the overdose, no active or further suicidal thoughts, plans or intentions. He wishes to be told what his diagnosis is, wonders whether his ADHD is turning into bipolar, still registered with the GP in Upminster where he lived before. It says not currently open to our service, previously seen by raid on the 11th of October 2016 following an impulsive mixed overdose. And then it goes on to say he has not had, since that hospital admission, his medication sertraline. With regards to drugs, denies recent use. Cannabis, said he uses this now and then as this helps him calm down. Said that he last used this a few weeks ago. Cocaine, reports he last used this within 3 months after being a heavy user for 3 years. Said he stopped using this himself, and that he was obtaining non-prescribed medication as well. It goes on to say, just on that same page, page 6, next to accidental self-harm, it's yes is indicated, and then it then says risk likely to be increased by impulsive behaviour, illicit substance use, and poor coping skills. Can you see that?
Yes, yeah.
And then over the page, if we turn to page 7, slipping the net. So this, I should just read the sentence before that. It says, it's been a long battle to find out what is wrong. He keeps slipping the net. Did not attend appointment offered to see a psychiatrist. He's been self-medicating all his life. He tells lies at times and is not always honest with her re his drug use and what he's up to. So this is referring to the conversation that you had with the healthcare professionals. Is that right?
Yeah, that's right.
And then it goes on page 7 to say that you've previously got random calls from him when he sounded delusional. He seemed to be having a psychotic episode. He's been under the influence of drugs at these times. He seems to blame everyone, and it is all about him. He can be all right for some weeks and then seem normal for 2 to 3 weeks, but this can change. She feels he is presenting as all right as the drugs are out of his system, but this may change when he uses drugs. She said that he's been self-medicating with non-prescribed diazepam, as well as weed and cocaine. She stated that he has said to her that he intended to end his life when he took the tablets, but is now saying he wants to be on the right tablets and be better. And then just skipping down, slightly further down, it says sister reported that he is impacting on her. She feels that he needs some sort of support, and that this has been going on for a while, and spoke of his previous overdose that he took last year. Patient declined needing admission as feels he can keep himself safe and wants to go home. And then it says, I want professional help. Is that in reference to you, or is that in reference to Terry? Can you help at all?
I think it was Terry saying that. There was often this sort of swinging between, no, I'm fine, I need to go home, and then, no, don't discharge me, I need help. He was really confused. He didn't know. He knew he needed help, but at the same time, and I think this is understandable, he just wanted to go home. Yeah. I mean, hospitals and the greatest of places or the safest of places to be in at times, and it's understandable that he wanted out, but then knew that he should stay and get the help.
Yeah, because it goes on to say, doesn't it, to speak to a doctor who can diagnose me and tell me what is wrong.
Yeah.
I think my ADHD is turning into bipolar. And then it goes on to say, I don't want to be admitted or anything like that. So we can see what you've described there, a slight change.
And also the stigma that around, Terry didn't want to be diagnosed with a mental health condition. He was in quite a lot of denial about that, even though he knew he was very unwell.
And then it goes on to say, I need tablets to help keep my mood at a level, to live a normal life and not to have my mood going up and down. And then there's a discussion with the doctor, and a plan was agreed to restart him on sertraline. Just turning over the page then on page 8, it says that he was discharged from RAID to refer to IAPT, which I think is improving access to psychological therapies. RAID to refer to first response team to consider urgently for medical review, and that he was given contact details for our service as well as details for bereavement service and drug and alcohol service. And then at the bottom of that entry after the 5th of December date, it says RAID Mental Health Liaison. Their entry is spoke to Sister Emma for collateral history with consent from patient. And I just want to ask you about that. You said before that Terry was always happy for mental health professionals to speak to you. We've seen here quite a detailed record of a conversation with you and a conversation with Terry as well. Can you just give us your perspective, please, on this interaction to the best of your recollection, appreciating as I do it was some time ago?
Well, this is one of the only times that I was actually listened to, and a detailed record of what I said had happened. In each one of these hospital admissions, or each one of these overdoses, suicide attempts, I had spoken to somebody or tried to speak to somebody every single time. And it usually fell on deaf ears. They were too busy. They were very indifferent. They didn't have the time to speak to me to obtain any kind of collateral history. So this is one of the only times where it was recorded. Somebody did actually listen and write it down properly. I lost track of how many times I said to medical staff, I'm telling you now, he will end up killing himself or somebody else. He's a danger to himself as well as others, when I was questioning why he was never sectioned. And it fell on deaf ears. It was like over the years just banging your head against a brick wall.
It sounds probably obvious, but why did you feel it was so important that they spoke to you to get that collateral information?
I think because for the most part, especially when Terry was in hospital, he was too unwell to articulate himself properly and to explain what his needs were. I mean, he was really, really unwell and would not be able to explain clearly to a doctor what was going on in his head. And there were also moments when he would become very good at masking. So if he thought, actually now's the time when I need some more drugs or I need to calm myself down, it was like at times he would put on a front, mask and make out everything was okay just so that he could get home.
And we talked slightly earlier on, we looked at the entry where on one occasion he's asking for help, on the next occasion he wants to be discharged, he wants to go.
Yep.
Would it be fair to say that, I think you described it as swinging sort of from one to another?
Yep.
If healthcare professionals were able to speak to you, is it that you might be able to put that into perspective?
Yes, yeah, exactly. I would have done, but for the most part, I was never listened to.
Can I ask you, is there any reason that you feel, perhaps with the benefit of hindsight, or perhaps that you felt at the time even, why you weren't listened to?
I think staff were too busy, is what it boils down to. I think obviously staff working in the NHS go into it with the right reasons, with a lot of compassion. And I think when you are really, really busy and really, really stressed, it can be very difficult to sit down and listen to somebody and get a full history of somebody's, and to read through medical records thoroughly.
And was there anything with regards to Terry's drug use, for example, that may have acted as a barrier to him receiving the appropriate care?
Yes, I think he was judged, stereotyped and dismissed as being a bit of a druggie. I think his underlying mental health conditions weren't taken seriously enough. I think there was a disproportionate focus on his substance misuse rather than his mental health. And the fact that he ticked every single box for being the most at risk of suicide, yet that was kind of ignored. It was like every single time they wanted to discharge him from hospital as quickly as possible.
Okay. I want to ask you about an entry on the 6th of December. So this is at the bottom of page 8, paragraph 13 of your statement. This is an e-put email sent on the 6th of December requesting that he be referred to the first response team, and going over the page to page 9, for an urgent medical review and a review by the Improving Access to Psychological Therapies. Can you see that?
Yeah.
And then just moving forward in time, there's another occasion, paragraph 16, if I can take you to that, page 10. We can see at the top of the page the date entry, the 23rd of December 2017. That's paragraph 15. But then if we look further down, it refers to a discharge on the 17th of December 2017. So I'm just going to read the extracts of this entry. It says here, Terry was seen by Street Triage today. Do you know what Street Triage is? Is that an organisation that you're familiar with?
I think it just means the police. Unless there is a psychiatric nurse or someone trained in mental health first aid.
I think we'll come on to that, and that might be able to help answer that. It says that he was seen by Street Triage after he was contacted his brother, informing the brother that he was having suicidal thoughts. It says attending police attended the scene and found the front door to be opened, and then it describes how Terry was found in the bath. On arrival, he was rather tearful, he was breathalyzed, he admitted to having smoked cannabis, which was evident whilst in the flat. It then goes on to say that he was discharged on the 17th from RAID following an overdose, and a plan had been put in place for him to self-refer to required drug and alcohol services, to register at a local GP, and provided emergency numbers should he require them. However, when I asked Terry about the plan, he has not done anything to date. Terry said his thoughts suicide were impulsive, and he no longer had any thoughts to harm himself or others. I just wonder whether we can unpack that entry slightly. Several things arise. This is an entry relating to another attempt to end his life. And it says it was prompted as a result of your brother, Terry's brother, phoning that he was having suicidal thoughts and police finding him. And that it says he had been asked to self-refer. And I just want to ask you about that self-referral to services, to the drug and alcohol services on this occasion. Do you have any views or thoughts about Terry's ability to follow up with a referral to drug and alcohol services, for example, given what was going on in his life at this particular moment?
Yeah, I think first of all it's important to remember what the police said to him at the time, which I think is awful. They told him to smoke a joint and calm down, and that was their response to somebody who was in the middle of attempting suicide.
How do you know that?
Terry told me afterwards, because even he himself was shocked that was what he was. That was the help on the evening that he tried to do this: smoke a joint and calm down. Anyway, that's the police. Giving him a number to self-refer, when Terry was that unwell at the time, he found it so difficult to cope and was struggling so much in such a dark place. There was absolutely no way he was well enough to pick up the phone and make an appointment. I mean, his struggles really were that bad that even a task like that would be impossible for him.
And so, given how you've described how Terry was, being as unwell as he was at the time, do you have any observation about the appropriateness of putting the responsibility on somebody who was unwell?
Completely inappropriate. I think for a mental health patient, for someone who has just attempted suicide, that's not an appropriate way to treat somebody like that.
I'd like to ask you to turn to... let me ask you this before we come on to the next entry. We can see here at the bottom of this page, before we move on away from this page, paragraph 16, the date is the 4th of January 2018. Can you see that?
Yep.
And at the bottom of that page, it's referring to the street triage service, 4th of January 2018. At the very bottom, the last line there, the date of the assessment, the 23rd of December 2017. Does this, therefore, this is a letter, it would seem, or an entry made on the 4th of January 2018, but it actually refers to an incident on the 23rd of December 2017, so sometime before that.
Yeah.
Is that right?
Yes, I think so, yeah.
And if we turn over the page to page 11, it refers to, at the top of that page, a psychiatric street triage liaison nurse. So does that help you at all with regards to the street triage team? It was a psychiatric nurse, I think, who conducted an assessment and said that he was having suicidal thoughts. Can you see that at the top there?
Yes, yeah.
It goes on to say... on discharge, 17th of December, so relating back to the earlier incident, so we've gone from the 17th to the 23rd of December, it says Terry agreed to self-refer to drug services, register at a local GP, and then this, which is similar to the entry we looked at before, but now it says to refer for bereavement counselling, of which he has not done to date.
And he wouldn't, because he was incapable of the state he was in. He was incapable of sorting out something like that, making the appointment.
Now, the next entry on this page, page 11, relates to the 21st of August. But in between this entry that relates to the 23rd of December, noted on the 4th of January 2018, and August 2018, was there anything significant that happened with regards to Terry in and around 2018?
I mean, there was always something going on with Terry. There was always some kind of drama. There aren't anything in his notes. However, I did recognise that there were a lot of his medical notes were missing when I was sent them after his death. A lot of them. So I'm not entirely sure I've got the full picture. There would have definitely been something going on, I can guarantee it. I obviously can't remember the exact dates.
Yeah.
But it was Terry, and he was unwell during this time.
Was there a time where he changed where he was living, the area that he was living in?
Yes, he moved from, I think it was he was moved from Upminster to Leighton, then to Basildon. So roughly the year before he died, he'd been moved to Basildon against his wishes. It was the only housing available, so he had to take it, and he was very unhappy about that.
And so moving Upminster, Leighton, Basildon, would that have been across different NHS trusts?
Yes, as well as North London for a while. I can't remember the exact dates.
And are you able to help us at all? You mentioned before that you think that there are things missing. Have you been able to try and ascertain why that might be, why there might be aspects missing?
I think it's to do with the transfer of medical records from NELF to EPUT. So late down the line, the transfer of information only happened in March 2019, which was a month before he died. Therefore, on the numerous occasions he was admitted to Basildon Hospital, they wouldn't have been able to see all of those previous attempts, all of the police incidents, the self-harm, the suicide attempts, the police attendances, and everything that he discussed with his GP.
And we've seen, we're obviously referring to Terry as Terry, because that's how he was known, and that's how you would like us to refer to him. But I've referred to a couple of entries where he's called Terence. Did that play a part in how he was registered with his GP and how his records were kept? Do you know at all?
Yes, so on some documents he was Terence, spelled T-E-R-E-N-C-E, which was the correct way to spell his name. Other records he was Terry. He was, I think I saw on one form, Terence, T-E-R-R-A-N-C-E. And there was also an error in his date of birth as well. So this certainly would have affected the transfer of care records, and also perhaps why some of the medical information was missing when they sent it to me after his death.
Okay. So I'd like to look at this entry, paragraph 17 of your statement, 21st of August 2018. It says here that Terry's brother, saying Terry is talking gibberish, he's taken drugs and now having a psychotic episode. Terry's brother stated this is not unusual and he has contacted the police, who will be attending when they can. Terry has moved from Leighton to Basildon. Terry reported that he lives miles away and was phoning to see if street triage would be attending. So Do you have any recollection of that, or is that one of a number of instances?
It's definitely one of a number, but I think it's important to highlight how after every incident, it was not only me trying to speak to doctors or trying to speak to the police or trying desperately to get him more help. It was also James asking the same thing, and James making a million phone calls and sending emails, and both of us kind of fighting the battle to get him more help.
And we can see here, this is, I think this would have been EPUT at the time, because if we turn over at the bottom of this page, before we do turn over, sorry, the bottom of this page is the date entry, 2nd of September 2018. And then if we turn over to page 12, it says SEPT, but it later says EPUT Mental Health Services. And the top of that page says he was referred to the Criminal Justice Liaison and Diversion Team for screening at Basildon Police Station, as he had markers for ADHD and wants to discuss his mental health issues. He's not currently open to EPUT Mental Health Services. He had a diagnosis of ADHD since the age of 17. He has a known history of cocaine addiction and impulsive overdoses whilst under the influence of drugs. Given input from Cruz for bereavement counselling. And then it goes on to say that he was offered screening to ascertain any risk of self-harm, suicidal, physical, mental and social needs, substance misuse or vulnerabilities. And then goes on to say that Terry declined to be screened, stating he only wants help to be released at that time so he can attend Norfolk, a 2-hour drive so that he can scatter his mother's ashes by 2 p.m. It then says he refused to discuss any issues, and a free text was put into Athena about his decline to the Criminal Justice Liaison and Diversion Team. I just want to ask you about that entry. So to orientate us in time, this is the 2nd of September 2018. Can you tell us what was going on? And
Well, we were about to scatter his mum's ashes in Norfolk, and I think he was, that was sort of making him more unwell, the thought of doing that, the thought of family being there, the thought of having to get himself there on time. And he was arrested. I can't exactly remember what the non-molestation order was. I think this might have been when he got into a bit of a fight with his ex-father-in-law. I'm not sure, who he wasn't meant to see. But he was arrested, and he was in a real state at the time, I remember. And in this report, it says he asked to see the psychiatrist. So he asked to see the psychiatrist. Obviously, that doesn't happen instantly, and he must have had to wait for overnight or for an assessment in the morning. But obviously, he was due to be in Norfolk to scatter the ashes. So I think maybe by the time the morning came, he was like, no, I have to go now. This is more important than sorting myself out. Which is understandable. So again, this kind of swinging between I need help, I'm really unwell, and then, kind of backing off. The psychiatric nurse didn't have any of the previous records.
so if to help in terms of the detail of this, on that page 12, paragraph 19, there's an entry on 2nd of September 2018. If we look at the final sentence in that short paragraph, he was seen by a CPN, I think it's a community psychiatric nurse in Basildon Police Station. And it goes on to say, and declined to be assessed or discuss any issues. I think you've just explained from your perspective why Terry refused that, and it's explained here as well about scattering his mother's ashes in Norfolk. If we turn over the page 13, at the top of that page, it says CPN, so community psychiatric nurse, informing the custody officer of Terry's refusal to be screened. Due to his refusal to be screened, no further support or advice could be or was offered. The CPN was unaware that he was open to habit. Are you able to help us with that? I think it's Havering Access and Assessment Brief Intervention Team,
Yes.
which I think is the organisation that fell under NELFT at the time. Is that right?
Yes, because he was living in Upminster at the time, so that would make sense.
And it says here he had a follow-up psychiatric appointment planned in October 2018. So you said that the community psychiatric nurse was unaware of his notes. It says here that the community psychiatric nurse was unaware that he was open to habit at the time and that he was due to have a follow-up appointment with a psychiatric appointment in October 2018. Why do you raise that, and why do you think that's a concern for you?
Because it's another red flag, it's another missed opportunity. The transfer of his medical records hadn't yet happened, so the community psychiatric nurse was unable to see the history. And I think perhaps if they'd have been able to see the history at that point, they might have been the one person who could have said, hang on a minute, let's look at this guy's history here. He has been seriously unwell, a history of overdoses, suicide attempts. He does tick every single box for being the most at risk of suicide. Perhaps we need to do a little bit more than just discharge him. And I think when you read through my witness statement, you can see time and time again how many missed opportunities there were.
So I want to turn now, sticking with some of those entries that you refer to. Bottom of this page 13, the 30th of October 2018. Turning over the page, you've made reference to the notes, or at page 14. It says here at the very top, these records were only uploaded to Mobius when GP referred to the FRT in March 2019. I think that's something that you referred to before with regards to the transfer of Terry's notes, which happened the month before he died.
Yeah, I think that's quite a crucial piece of evidence in this, that, you know, the months leading up to his death and these events where he, you know, from 2016 onwards, when he did become more unwell, hospital staff weren't able to access that information. They weren't able to see the history. They weren't able to see the amount of times he had visited the GP, the amount of different referrals, the amount of times he had attempted suicide, or there'd been some kind of police attendance or self-help, you know, that was not visible to them. So they weren't able to gain a picture of how serious his mental illness was.
And what it says here, this is information that's been gathered from the root cause analysis report, which we'll return to. But it says here that Terry was seen by a consultant psychiatrist in Habit because his GP at the time was in Upminster. And this was a follow-up appointment, and he'd been previously seen in August 2018 and undertaken a full assessment, which is documented. And part of that assessment was that he had a diagnosis of mixed anxiety and depression, mounting social stresses, and in the August assessment, the consultant psychiatrist considered he had an underlying personality disorder. It then goes on to say that in the interview, the consultant psychiatrist stated that Terry was calm, cooperative, tearful at times, and appeared moderately depressed, that he denied any intention to kill himself, he had protective factors, not hopeless or helpless, and the consultant psychiatrist noted no other positive findings on his mental state with no evidence of any psychotic symptoms. The doctor asked for his general practitioner to increase his antidepressant medication, and details of that are provided, and that the plan was that he would be seen again on the 7th of January 2019. Can you see that?
Yes, yeah.
I'm conscious of the time, Emma. I think we've been going for an hour. I think before we move on to January 2019, which is where I'm going to ask you questions about now. Now's probably a good time to take a break. So perhaps if we take a 10-minute break now and come back at 4:20.
Yeah, lovely.
Thank you.
Chair, thank you. We will play the second section of Emma's pre-recorded evidence session tomorrow at 10 a.m.
Thank you.